Now, at 1 month, their vision gets a little bit better. Their vision improves to 20/600, still not great, and they're starting to appreciate a little bit more in terms of contrast. At 2 months, this is going to even get a little bit better, and they start to see 20/400. So again, we're starting to improve with the vision. They're still not really able to make out real defined shapes or anything like that, or even appreciate subtle color differences. But those receptors are starting to form. At 2 months, we also see that babies are starting to follow moving objects. We call this fix and follow. So you'll show a little toy, they'll be able to move. They can't quite move their head yet, but their eyes will start to track that object. But if your child does not have this tracking ability at 2 months, do not worry. This really has a range. It's not hard and fast at 2 months. This really develops anywhere from about 2 to 4 months of age. At 3 months, we again start to see an improvement in the way that the eyes work together. They are starting to track a little bit more. The vision improves to 20/300, and you'll start to notice them becoming engaged in their toys or even in your face. The most fun part at age 3 months is they notice you smile, and that sometimes they'll even smile back. And that's just a really rewarding time for being a parent. I still remember that stage with each of my 3 kids, and it's just so amazing for you to smile at them and for them to know that they're recognizing that. Now at 5 months, babies start to develop some depth perception. They start to see in 3 dimensions, which they really haven't been able to appreciate up until that point. And their vision's about 20/200. At 6 months, we really see a big improvement in their vision. They're starting to be able to recognize faces across the room. Their vision's about 20/80, 20/100, and their color vision is really starting to come in. So now we're starting to see some improvements. They are going to start to prefer certain toys, the brightly colors. You don't have to just stick to black and white and big geometric patterns anymore. At 8 to 9 months, your baby's starting to crawl, and this does a lot of things. This really improves their hand, foot, and eye coordination, and that's going to get the visual system to develop even better. Their vision starts to improve to about 20/60, and they're starting to grasp at things, and they're really starting to truly play and interact with their environment. It's such an exciting time. At 1 year, a baby can actually judge distances, and this is probably the most amazing thing. Their vision's really going to be about 20/40. Now, we can't put a baby in a little eye exam chair and have them read the eye chart, but this is what our estimates are about their vision, and they're able to recognize people and objects across the room, so they're truly starting to interact with their environment. Past the age of about 1, their vision is about 20/30. So you've got a 16-month, 17-month-old baby. They're almost at adult levels of visual acuity. So the number one question that I often get is, how do you even check a baby's vision? You can't put them in the eye exam chair. That is 100% true. We can't do that. But we have a lot of different ways that use objective measurements to be able to check to see what a baby should be seeing, or if they have any issues, what their glasses prescription would be. So we'll start with, what does your pediatrician do? Your pediatrician is checking basically to make sure there's a red reflex. If there's not a red reflex, that could be a sign of a cataract or even a special kind of eye cancer. So they're checking to make sure there's not something super serious that's limiting the amount of light that gets let in through the eye. They're also checking to see if the baby is able to track at the various milestone appointments, if they're meeting these visual milestones that I discussed before. And then last, they're checking the response of the pupils. The way that the pupil constricts to light is really important, can tell us a lot as to what's going on in the brain, what's going on with the optic nerve pathways. So these are all the things that your pediatrician is checking just at the well-child visits when you're going in those newborn months. Now, your pediatrician may also have what's called a Photoscreener. It almost looks like a big instrument that the nurse or maybe the doctor will hold, and your child sits or stands a couple of feet away, and they're taking this little picture of the child's eyes. What they're actually doing is they're able to get an assessment of the refraction. The refraction means the prescription, the glasses prescription of your child. They're able to get a sense also if there is a red reflex that's missing, or if there's any crossing or deviation of the eye, if there's a lazy eye. These photo screeners, especially depending on which one is used by your pediatrician, can be really accurate. Oftentimes, I will get a patient into my office referred by a pediatrician because they failed the vision screen with this photo screener. And when I do my more comprehensive and more thorough evaluation, I get numbers that are quite similar to what the photo screens have gotten. So this is actually a pretty reproducible and pretty reliable way of telling what your child is able to see. And then me. What do eye doctors, especially pediatric ophthalmologists, do in the office? How are we able to tell what type of glasses prescription you need? So obviously, with a pediatrician or even a school-based screening, they are not doing these types of techniques. What we do in the office is something called retinoscopy. This is the whole reason that we have to put the dilating drops into your child's eyes to be able to enlarge the pupil. It gives us a way to focus the light using our instruments called retinoscopy. It's a little handheld thing you'll see us with a streak of light. And then I'll also put forward a bunch of different lenses. So once the pupils are dilated with those drops that babies hate as well as adults, I'm able to focus the light and then assess by running my different types of lenses in my hand. I can get a very accurate number as to, is the child farsighted? Does the child have astigmatism, or are they nearsighted? Now, here's the thing. Almost all babies are farsighted, and that might sound strange. It doesn't mean that they cannot see up close and they can only see far away. It means their eyeballs are short because they're babies and they have not fully developed. So their eyeballs are short and they are hyperopic. But that's fine. It doesn't mean they can't see, because just like everything with a baby, it's extremely elastic. Their lens in their eye is able to focus well past a large amount of plus power or hyperopia. So you don't see all babies wearing glasses. It's actually pretty rare for a baby to need glasses. But if you were to measure every single baby like I do, they actually measure with some plus prescription. They aren't right at zero. I'd be concerned if they were at zero, because that would mean that likely they're going to become nearsighted in the future. So retinoscopy is our objective way of being able to tell if a baby needs glasses right there in the office. Based on those measurements that I do just with this very simple handheld retinoscope, I'm able to give you a glasses prescription for your baby and be able to follow them. Now, they're not reading the eye chart, but this is just as accurate. This is quite similar to if you go to the eye doctor and they do a little automatic measurement. They put your head in a machine and you see kind of a farm or a house and it kind of comes in and out of focus. That's an auto refractor, and I do it by hand, as do all pediatric ophthalmologists. We do it by hand for babies and toddlers and kids who are too young to be able to sit in the auto refractor. But it is accurate. Just because it's done by hand doesn't mean it's not accurate. In fact, when I do it by hand, I'm even more accurate because I can make sure that the child is looking exactly where they need to be looking. Sometimes, kids, they've got short attention spans. They're looking all over the place. This is a really accurate way of determining the glasses prescription. So you can feel confident if you saw a pediatric ophthalmologist and they checked and did the dilating drops and did this funny looking thing that we have assessed to make sure if your child needs glasses. And likely they probably said, oh, that's a normal amount of hyperopia for your age and no glasses are necessary, because their lens can focus all the way, all of those small things. Once you're past the age of about 40 or 45, like I am, our lens does not change shape in that same way. And that's why we all need reading glasses. But that's a whole different topic right there. For more tips on eye health, parenting, and staying focused in a busy world, follow me on Instagram at Dr. Rupa Wong, or head to drrupawong.com. Until next time, keep your vision clear, your priorities focused, and your family thriving.